Bismillah ar-Rahman ar-Rahim, my dear vascular colleague. I would like to invite you today for the third lesson regarding artificial intelligence and machine learning. And here we'll do something which is a little bit creative. We are going to have a vascular conversation with the ChatGPT-3. My name is Dr. Mohamed elfarok. I'm a consultant vascular surgeon. I'm developing a free course teaching artificial intelligence machine learning for vascular surgeon. If you are interested, you can photo the QR code and log in for this course. And I will try to show you the capability of machine learning in the recent era of vascular surgery. So let us talk about ChatGPT-3. What is a ChatGPT-3? This is a program developed by OpenAI, which is a company that was originally open source, which means free of charge, open to everyone, but now it is a closed source and it is profitable company. ChatGPT is abbreviation of generated pre-trained transformer. This is a language that, in simple terms, like if you put all the information over the internet in one brain, and then you ask this brain the question that you want, it wouldn't give you options like Google, it will give you single answer. Can we benefit from ChatGPT as vascular surgeon? A huge amount of benefit. And over the next couple of weeks, there is a new development, which is GPT-4. We are dealing with a version 3. Now, version 4 is amazing because you will have not just a text reply, because it's a language module, but you will have image reply and you will have video reply. And it can read text, image, and video. But let us take it little by little, start by GPT-3. Well, it's like a conversation you are going to have with a GPT-3, and someone will tell me, well, how this can help me as a vascular surgeon. So let us take it little by little. I have prepared some questions, and let us ask ChatGPT about it. So if I go from this PowerPoint, if I copy this question, and then I will go to a ChatGPT, and then I will put the question. What is the best vascular book to read? Which is a very common question. A lot of you have asked this. There are many books. I will stop generating. As you can see, it's a very good answer. There are many excellent books. That is fine. And he put Rutherford Vascular and Endovascular Surgery as number 1. Secondly, he put Vascular Medicine, a Companion by Bromweld. Again, this is very important. So you can have the books that you want. It's very easy. And it will tell you what is the best books that you can read. And this is definitely is very helpful. Notice that in GPT-3, the information you get is up to 2021. So the more we are going to use it, hopefully 2022 and 2023 data will be put in. But at least it's very good. Now, this is the free version, and there is now an upgrade to GPT Plus, which is a new version, which have a little bit more sophistication and more advantage. So we'll take another question. So this question is correct. Let us say I'm going to an exam, MRCS or Egyptian Fellowship or whatever. And then I want to ask ChatGPT to tell me how I can do a study plan. So let us put this question. Create a study plan, MRCS second part, with a timetable from a reliable sources. So I am asking ChatGPT to give me a study plan. How to study? Well, preparing MRCS examination require comprehensive study, and this is a plan. In 3 months, he put week 1, week 2, anatomy, physiology, then pathology, pharmacology, then the topic for another 3 months, general surgery, trauma, orthopedic, and phase 3 revision. And he did put the timetable for the revision. Timetable, he put week from 1 to 12 foundation, ENT. So he can actually put to you uh, study plan. And you can speak multiple language. You can speak in Arabic and you can speak in English, in French, and whatever. So let us say create a study plan for passing FRCS VAST over the next 6 months. So I've put another exam. He put the definition of FRCS, and then is a study plan, foundation and knowledge for 2 months, and then core 2, another 2 months, vascular assessment investigation, open vascular surgery, then endovascular surgery, and he put the timetable for everyone. So as you can see, it's pretty good. So you can make your study plan right away. Let us say that you have a master degree from Ain Shams University, Cairo University, and you want to know what is the best topic to speak about, to present it to. So let us say, what is the best vascular topics to choose from for my master degree in vascular surgery from Ain Shams University. Okay, so let us see. He's taking a few seconds because there is a huge amount of traffic on Google GPT-3, so he's trying to collect all the information. Choosing the best vascular topic for your master's degree in vascular surgery from Ain Shams University will depend on your personal interest and career goals. However, here are some of the top vascular topics that are highly relevant and in demand in the field of vascular surgery. This is exactly what I want. Endovascular surgery include topics such as endovascular aneurysm repair, EVAR, peripheral vascular disease, another great topic, endovascular embolization, vascular trauma. So this is exactly what I wanted. And you can see it give you the topic to do your master degree. And another great tool, can you speak to ChatGPT as if he's a man. Can you summarize you YouTube video and give a summary? This is a fantastic capability. So if you have a lecture 2 hours, yes, he can give you a summary of that lecture, and he can write it down for you, and he can concentrate it, so it can actually save you time. Not only that, but it can actually summarize books. Books can be summarized. It can also give you diagnosis. So if you have a patient, let us say, uh, what is the diagnosis of a 40-year-old patient with pain in the left arm and absent pulse and cold left hand. So I'm giving him a simple case, trying to check if he's able to diagnose or not. Again, because there is a very high demand, it takes a little bit of time. I'm just trying to give you an example how this tool is extremely useful. So this patient can have an acute ischemia, chronic ischemia, can have a Steele syndrome. I've given him minimal amount of information. So the symptom 40-year left old man, left hand are consistent with a condition called acute limb ischemia. So he did diagnose that right. And is caused by sudden decrease in blood flow to the limb. I can actually ask him what is the best investigation and so on. So it's pretty good. So when you get a difficult case, you want to think about it, why not? By the way, if you have any question you want to ask a GPT because it is blocked in Egypt, just put it in the comment section of this YouTube video and I will put it to ChatGPT or we can discuss it over the next case and then we'll see how it goes. So this is how it can actually give you a diagnosis of some of the diseases that you. So let us say, what is the flow chart of managing symptomatic internal carotid artery stenosis internal carotid artery stenosis from reliable sources. Here is a question, but you know that if they have a guideline in 2022, it will not be included in this. But let us see what is the flow chart of managing symptomatic internal carotid artery. We know that if you are symptomatic, more than 60% either carotid artery stenting or carotid endarterectomy. But here is a flow chart outlining the management of symptomatic internal carotid artery stenosis. This is his answer. Let us see how he will solve this. He referred from the American Heart Association, AHA, stroke. Diagnosis, stenosis based on imaging. We know that duplex and CT angiogram, sometimes MRI angiogram, and carotid. I'm just wondering what is the percentage he will say for intervention, but he said from AHA, initial antiplatelet therapy, such as aspirin, and evaluate the revascularization with either carotid endarterectomy, CAA, or carotid artery stenting CAS. Again, all this are correct. Again, the period of 2 weeks from having symptoms of high-grade stenosis, 70 to 99%, and is at low risk. So you can see, again, perfect answer. I will stop generating from here. So it can give you diagnosis, it can summarize cases, it can give you a study plan if you want to study. It can give you also a flashcard to study. So let us say create a flashcard to memorize cranial nerves. You know, a flashcard is something where before the exam you put a card, you try to remember as much as you can. So you see the card on the day before the exam. So let us see, is he able to create a flashcard? That's true. Here is the front of the title cranial nerve image. Then you put the name, the function of the nerve, mnemonics as well. And he put very nice mnemonics for the olfactory, sensory, optic nerve, and then you go to the rest of the cranial nerves, again, to memorize them, function of each nerve. Also, all this is done within seconds. So it's a very good study companion to a vascular surgeon. And not only that, you can also create code with it. And that is why this lecture is important for my course. I will say, for example, create a Python code to diagnose aortic artery aneurysm from patient DICOM file. Well, this is very difficult question. So it's not an easy question. As a language model, I'm not able to access patient data, so that's fine. If you have the patient DICOM loop, suspect aortic aneurysm, it's important to consult a qualified because this is for medical legal. So he didn't actually give me a code for this because he saw this is related to patient, will take a decision, so he want to be absolutely safe. But he can create Python code. I will mention here, can you create Python code? Python is the language we're going to use in our course. It's very easy. And hopefully we'll give you a book about learning Python in one day because it's very easy. It doesn't need previous computer programming skills. So let us see. He's taking time to answer because of the huge amount of traffic. Yes, I can help to create Python code. Please let me know what specific task or problem you need to help, and I will do my best to assist you. Okay, so we'll we'll go back to our presentation. I just wanted to give you a glimpse of what this terrific, this excellent tool that can help you. We have discussed these questions, how to create flash study card. It can give you differential diagnosis. This is one of the beautiful as well. If you want a question for revision, we'll go back to ChatGPT. Here it is. So I will tell him create 3 MCQ questions on vascular surgery. Mention which is the correct answer from reliable sources. So I've told him here to create 3 questions. What is the most common site of abdominal aortic aneurysm? This is easy. It's pretty easy, isn't it? Infrarenal aorta. What is the most common cause of acute limb ischemia? Again, pretty easy, which is embolic. What is the golden standard diagnosis chronic ischemia? The gold standard is, of course, CT angiogram, which is answer is D. So he created to you 3 questions. You can actually also say what level you want of difficulty. And I mentioned at the end, thank you very much. You are great. Just out of politeness. And also he replied to polite. So you are welcome. I am glad it helped. Don't hesitate to ask me if you have any question. So if you have any of the member of this course have any questions, just let me know and we'll put it into ChatGPT. Here's another example of 3 questions. It can create a summary of lecture YouTube, can give you mind map. And I hope with this course I've introduced a new tool to vascular surgeon, and I wish you all the best.